Namaste, I am Dr. K. Nischal, practicing as a consultant dermatologist at Nirmal Skin Hair Clinic, Bangalore. I am practicing since 2007 and dermatology has seen vast expansion. Aesthetic dermatology has become a part of clinical dermatology and we are catering to both aesthetic dermatology as well as clinical dermatology since 2007. Skin has an outer layer, a middle layer which contains collagen and a deep layer which contains fat. So the outermost layer of the skin, actually if you see, it looks something like this with all the wrinkles or folds or the markings. And if you see inside the skin, so what you see is this is an upper layer of the skin. This is the middle layer of the skin which contains collagen, which gives volume to the skin, and it also has a lot of appendages like the hair, the sweat ducts and also the blood vessels, and below that is the fat. So when we say skin barrier, we are basically speaking about the uppermost layer. It is like a compound wall to any building. So this layer is composed of dead cells as well as the living cells. The outermost layer which protects our skin and which is rigid is the dead cell containing area. See, if you assume outer layer to a wall, we have bricks as well as we have the cementing substance. So the dead cells and the living cells, they form the bricks of this layer, whereas the intermediate cementing substance is a layer which is made up of protein and fat. So it's called as a lipoprotein area. So these two things together, they protect our deeper layers of the skin and the internal organs. So whenever the outer layer gets damaged, there is a damage to the entire protective layer of the body. How does it get damaged? One most common thing is the dryness of the skin. So the dryness can be inherent. See, sometimes people are born with a very dry skin, like in conditions like ichthyosis, or it can be because of practices. When we take a very hot water shower, when we use aggressively a lot of soaps or a hard soap, when we are not moisturizing the skin, the dryness can happen. Or when we are in climate conditions, say for example in cold weather, or when you are going to a higher altitude where it is windy and very cold. So for example, you go to a trek, so you are trekking and there is a lot of wind, so that can also cause a lot of damage to the skin. So what happens exactly in this process is, so whatever the cementing substance is there, that is getting damaged or taken off. So what happens whenever we use a lot of detergents? So it's nothing but it's a soap, so that removes all the fat. As I told you, between the dead cells and the living cells, you have a layer of lipoprotein content. So lipo is nothing but fat. So if at all you use a lot of detergents, the fat will go away. So once those cementing substance goes away, the skin starts becoming loose, it starts becoming dry, and you develop a lot of cuts or fissures within the skin. So this is how the barrier is lost. Once the barrier is lost, you are more prone for infections as well as allergies. So how do we prevent it? So prevention is basically trying to maintain a soft skin. So as I told you, excessive use of soap increases this. So avoid using excessive soap. If you want to use a soap, use a mild cleanser which does not contain a lot of detergents. So you can have a soap-free cleanser which is helpful, or you can use a micellar based cleanser which are much more milder. Second aspect is, before you take bath, before you take a shower, apply liberally coconut oil, massage and then take bath. Whenever you are taking bath, use lukewarm water. Don't use very hot water, because whenever you use hot water, it removes all the fat content in the skin. It is just like how women use hot water to clean a vessel which has a lot of oil content. So do not use very hot water. And the best thing is taking shower in a lukewarm water or cold water. And immediately after bath, dab your skin dry and then liberally apply moisturizers. Whenever you apply moisturizer on a damp skin, the moisture works much better when you apply on a dry skin. So for that reason, the moment you take shower, dab it dry, put a moisturizer and then wear clothes and come out of the washroom. By taking care of these simple techniques, you can maintain a soft skin. Another one important dietary aspect is have a lot of omega-3 rich food. For example, walnuts, flax seeds, fish, especially the sea fish like salmon, tuna and sardine fish are rich in omega-3 and they help to maintain the lipoprotein layer of the skin. Not only that, nowadays you get oral ceramide tablets which also help to reduce the dryness of the skin. By taking care of these aspects, you can maintain the skin barrier and try to reduce the damage.